If you've been trying to get pregnant for some while and it seems to be dragging, you might want to know the cause of the pregnancy delay if there are any issues whatsoever. Maybe you've been to the hospital and they keep telling you that everything is okay, your tubes are fine, your uterus is fine, and all those stuff. However, there might be some hidden causes or some covert causes that might actually contribute to this pregnancy delay, which can be hidden, which can go unnoticed because, they don't pose any physical threat or physical damage to the body. So we often tend to underrate them sometimes. So if you're trying to conceive, please watch this video with an open mind and I hope it turns out useful to you. Hi Diamonds, welcome. I'm Diamond Mom. Welcome to my channel. Please subscribe to this channel if you've not done so, and please share this video to whomever you feel it might be useful to. The first possible cause for a pregnancy delay, which oftentimes tends to go unnoticed, is the issue of low progesterone. Progesterone is the pregnancy hormone that is responsible for preparing the body, the female body, to receive pregnancy. And also during pregnancy, it also ensures that the pregnancy is carried successfully. So if a woman has low progesterone hormone, there are chances that there will be delay in pregnancy, and most often the attention is not focused on this. The attention is focused on the bigger issues like, are my tubes open, are my tubes free, do I have PCOS, and all those things. But this pregnancy hormone is very important as it can cause a delay in pregnancy if it is too low in the woman's body, because it is the hormone that helps to prepare the womb, the lining of the womb, to be thick for it to be able to carry a fertilized egg. So you would want to rule out all traces of low progesterone hormone by visiting your hospital and asking your doctor to conduct a test on your hormones to check if the levels are okay. And if it is confirmed that your progesterone is low, there are diets, there are supplements that your doctor can place you on that can be helpful. But it's better to be sure that this hormone is okay than to just call it bluff. The second possible cause of pregnancy delay would be high level of prolactin. I feel like this issue is not even discussed about well because so many women fall the risk of having high level of prolactin. I was once a victim. In my teens, I was around 15-year-old then, and I had been diagnosed with lump in my breast. So I went to the hospital, had series of tests, scans, and I was placed on drugs, to actually see if it would wipe away the lumps or if it would require a surgery. Now, I think it was during this treatment or after the treatment that I noticed that my breast started to leak. I was a teen, I wasn't pregnant, I wasn't breastfeeding, but I noticed that fluid was coming out of my breast milk. So I had to go for another test and it was confirmed that my prolactin level was high. Now, guys, I was placed on drugs and after some weeks, everything went back to normal. But why I'm saying this is that many women fall the risk of having high level of prolactin and they actually call it bluff. Like they're like, oh, it doesn't, as far as I'm not breastfeeding, I'm not pregnant, But like as a woman, there are some signs. In fact, no sign in your body should go unnoticed by you. No sign in your body should be taken to be unimportant by you. Like you should take every sign important because it is very hard for someone with high level of prolactin to be pregnant. Prolactin is the hormone that you need when breastfeeding. Also, when you're pregnant already, the hormone is there, but more, it becomes high when breastfeeding. And it is because of this hormone that we say that breastfeeding is a natural family planning. So if this hormone prevents a woman from getting pregnant, why actively breastfeeding? And if this hormone is unusually high in a woman that wants to conceive, it's just natural that there'll be difficulty in getting pregnant. So I would advise that you also check for your prolactin level to be sure that it is not on the high side. And even though you find that it is on the high side, it is nothing to be, to be scared of or to be alarmed or to be afraid of. It is something that can be treated by the right medication. And in few weeks, you will be okay and your prolactin level will become normal because you need a normal prolactin level to be able to conceive, to avoid delay in pregnancy. And also, leaking breasts, or will I say breast milk, is one of the many symptoms that might follow this high level of prolactin. So, but for me, the symptom I noticed was that my breast milk started to leak without me breastfeeding or being pregnant. So, but there are other symptoms that you might want to check out for in your body. Or better still, just to be on the safer side, just go for the prolactin level test to be sure that, that this prolactin is normal in your body. The third possible cause of pregnancy delay would be anovulation, like when you are not ovulating at all. Now, we know that ovulation is the release of egg from the egg sac. And for you to be pregnant, you need at least one egg for you to be pregnant. So in a situation whereby you are not even ovulating, like there would be pregnancy delay. Of course there will be delay in pregnancy, so you can check that you are ovulating by getting, your ovulation test kit, or better still, go to the hospital and ask for this ovulation test to be run on you to be sure that you are actually producing eggs. Because if your body is okay, if every other thing is okay, and maybe you're not ovulating, or you ovulate maybe once in 3 months or 4 months, I mean, there would be pregnancy delay. So you would also want to go to the hospital to be sure that you are actually ovulating. And if you find out that you are not ovulating, then I'm sure there are medications for it. Also, there are supplements that you'll be placed on. There are diets that your doctor would also prescribe for this issue to be treated. Another likely cause of pregnancy delay would be an undetected issue with your reproductive system. Like maybe you've been to the hospital and they notice that, okay, your tubes are okay, your womb is okay, you don't have endometriosis, you don't have hypothyroidism, you don't have like those big issues that would actually be easily noticed. You might want to check for cases of prolonged infections. Like you would want to think back, have there been times when you've had infections and you call it bluff and be like, don't worry, it will go on. So maybe you've had prolonged cases of candidiasis or fungal infection, or bacteria. You would also want to check for fibroids that might prevent a woman from getting pregnant. So I don't know. So you might want to check for some things, for some issues that would go undetected. And to check for this, maybe you've checked with a first hospital and they say everything is okay, but deep down you know that something might be wrong. You would want to check with a second hospital, to seek for a second opinion to be sure there are no infections. There are not, because there are some cases whereby infection would be prolonged in a woman's body, and then it will be so relaxed that even the woman would be used to it, and you would not even know that you have infection because it's been in your body for years, and then you've come to be so comfortable with it. So you would also want to check for any infection in your body that might want to cause delay in pregnancy. Another hidden or often underrated cause of delay in pregnancy would be exposure to chemicals, like exposure to pollution. Yes, we know our body, like the woman body, the female body, is very delicate, like inside, so it needs to be protected from harmful substances, from harmful pollution, gas. Maybe if you're working in an environment where you come in contact with pollution, with some chemicals, some harsh chemicals on a regular basis, like the one I know of, formalin, caustic soda, like some chemicals that normally, like physically, you know that they're actually wrong, but then you've been working in that environment, or you've been living in that environment for a very long time. You might want to check that this might not also be the cause of the delay in pregnancy, because this exposure to radiation or chemicals, gas, pollution, these sawmills, they can harm the woman body. They can cause a mild, like they can cause as much as a little harm to the woman's body. In fact, they might even be working against, as you're trying to get pregnant, they are working against you trying to get pregnant. Maybe if you receive what is meant to get you pregnant, the presence of these chemicals or the effect on your body will be causing a counteraction, thereby resulting in delay in pregnancy. So you would also want to check where you are usually at most of the time, where you work, where you reside in, and things that you actually consume, things that you also take in. Related to this would be caffeine, or too much of alcohol, too much of smoking. I know some people will do this and they will go scot-free, but you just want to be sure that this is not the possible cause of your pregnancy delay. Another possible cause of pregnancy delay would be self-medication, like when you have to take medications on your own. You feel like, okay, I'm having irregular cycle, or without even, maybe you just started trying to conceive, and then you notice that the first month there was no positive results, and then you go to the chemist or to the pharmacy and you ask for Clomid, you ask for some things. Like some people go as far as taking concussions, what we call agbo, and all those, those liquid substances into your body without getting the right prescription, without getting to be diagnosed first of anything. So self-medication as a means of prevention is better than cure. In this circumstance, might actually be another cause of pregnancy delay. So you really want to be sure that you are not self-medicating. You're not just going on your own to ask for drugs to increase your progesterone level or drugs to reduce your prolactin level without getting diagnosed first, because you might not have any of these issues, and you taking drugs for that issue might just cause your body to be fighting against herself and causing delay in pregnancy also. The last possible cause of delay in pregnancy I would be discussing would be obesity, as well as underweight, like overweight and underweight. I know we get to hear of obesity, overweight, reduce weight, but also watch it that you're not reducing weight too much that you get to fall to be underweight, because if you're underweight also, it can also lead to delay in pregnancy. So you want to watch it that you are in the right weight. I know this can be hard, but I mean, you just have to try as much as possible to discipline yourself, by working out in the right way, not over working out and not under working out, because you want to maintain the right weight for you to be able to rule out any issue of pregnancy delay. So guys, these are some causes that I feel might be hidden, because they don't get to be discussed most often. We only get to hear of the big names. You have this, you have that, or maybe okay, you're perfectly okay, but deep down you know that something might be wrong. So I would suggest that you also check for any of these things in your body. You reflect and check your environment, your body. You also go to the hospital and specifically request for this test, because maybe you might go to the hospital and your gynecologist might not even think it's wise to run a progesterone test on you or a prolactin level test on you, but you can request for this since you now know this. So I hope this video was useful to you. If it was, please give this video a thumbs up. Also subscribe to this channel, and please, most importantly, share this video to anyone you feel might be going through this situation. And you never can tell, it might be of use, it might be like of a great help to that person. Thank you for watching, and I'll see you guys in the next one. Bye for now.